Clinical research and clinical trials provide opportunities for our patients to receive treatments through drugs or devices that they wouldn't have access to otherwise. We are excited and honored to share with you a story of a patient who traveled a very long way just to enroll on a study that we had open here at Memorial Care.
Narcolepsy is a sleep disorder that affects less than 1% of the population and is usually diagnosed in adulthood, but probably starts in childhood. It's an interesting condition because children or adults present a little differently. Adults present, their prime complaint is, I'm just super sleepy, my life is a fog, I cannot cope. Children usually present with school failure. They struggle at school, and that's because they're falling asleep. It may not be that they're actually putting their heads down on the desk, but they may be having what we call microsleeps. These are sleeps that may last, sleeping events that may last maybe just a few seconds, but maybe multiple times an hour. So you can understand that when they're sitting in class, they're just missing out information, and so it results in school failure. But there's a tetrad, what we call in making the diagnosis. So number one is excessive sleepiness. Number two is the condition of cataplexy, which is quite strange. This usually presents when a person is exposed to some form of emotional excitement, usually laughter. And then what happens is they start to feel weak. But for treating cataplexy, that's pretty tricky, because the stimulant medications don't help with cataplexy, and cataplexy can be debilitating because we find that particularly with children, when they have cataplexy, they start to avoid social interaction because the kids are joking around and they don't want to be embarrassed, and so they avoid any situation that might cause them to laugh. And it's not uncommon for us to see children that are becoming socially reclusive as a sort of protective mechanism so they don't get cataplexy, because it's really embarrassing. But Xyrem, sodium oxybate, is a medication that's been used in adults very successfully for treating cataplexy for a number of years. And we were involved in a drug study to look at the safety and efficacy of sodium oxybate in children. And as part of a multi-site study, we were accepted into this multi-site study program. And we had a subject that was enrolled that resulted on having this, on using this medication, had some phenomenal positive results to sodium oxybate.
I remember when our research subject came into clinic for the first time. He was a shy 13-year-old boy. He was embarrassed of his condition, so he rarely spoke to us. He would sometimes slur his words and doze off during our conversations. Mother was so desperate to have a treatment for her son that she actually traveled all the way from Utah, and they came every couple of months for almost 4 years. His mother was so thankful that we arranged their air travel, transportation, and hotel accommodations for all his study visits. During some of his extended stays, we also arranged for them to stay at the Ronald McDonald House here in Long Beach. The subject, once completing his participation, was a totally different kid. He was now interacting with the staff. He wasn't dozing off. His grades improved, and he was involved with sports. And those are things he weren't able to do before. Recently, I had to contact Mom and discuss some things with her. During that conversation, she was so happy to hear from me. She felt like we became friends, and that she was kind of sad that the study participation was over.
So it was a pretty successful trial. I mean, we only enrolled one subject, but
Right.
He showed some significant improvement. In fact, his quality of life completely changed. And I remember his mother. I mean, she was just so relieved. And there was a time when she was very concerned that we were not sure whether this product would actually be approved by the FDA, and it was sort of a very tenuous time. Would he, because he did so well, would he be able to continue? And what was so cool was that it eventually became FDA approved, so for sodium oxybate to be used in children, which was great. And subsequently, I've seen a lot of patients now who are in the pediatric age group and are using sodium oxybate with very, very good